Welcome. Welcome from the Department of Public Health and Human Services at the University of Michigan Flint. This presentation will include information on the Flint water crisis and give information that is important for mothers or potential mothers to understand. During pregnancy, lead poisoning can have adverse effects on the health of the mother and the child. This presentation will provide information on the background of the Flint lead water crisis and give guidance on what water is safe, how to minimize exposure to lead, and how to mitigate the effects of lead poisoning for both mother and the developing child. As you can see, there's a lot of information about the water crisis coming from countless sources. It is often difficult to know what is correct and how to proceed. This presentation hopefully will clear some things up. Much of the information in this presentation was gathered from experts in the field, to include the Genesee County Health Department and information from scholarly sources. What is lead? Lead is a metal element and is designated by the letter Pb on the periodic chart of elements. Lead is a corrosion-resistant, dense metal that can be easily shaped. It is used in numerous industries. Lead exposures can occur from the natural environment, from contaminated air, water, or soil. Lead can also be found in the homes from sources such as paint, in older homes, or from the water lines. There are many sources of lead. Knowing these can help the mother make educated choices to reduce her risk of exposure. A partial list of sources includes tap water, older water pipes, lead solder, brass and bronze components, lead paint, car batteries, air, and soil. When water leaves the treatment center, it is rarely contaminated. The lead leaches out of the pipes if the water is not properly treated to reduce its corrosiveness. Lead solder is used by electronic hobbyists. Lead paint is found in homes built before 1978. The liquid in car batteries has lead. Lead in the soil and air can come from industrial emissions. Humans typically get the greatest exposure from the intake of lead orally, from water, or through breathing dust or paint particles. Lead poisoning occurs when the lead builds up in the body over a period of months or years. So how did the Flint's water get contaminated? In preparation for the switch to the Karen Gandhi water pipeline, the source of the Flint's water was changed from the Detroit water system to the Flint River in April of 2014. The Detroit water was treated with high enough levels of corrosion inhibitors to minimize its corrosive properties, which prevented the lead in the pipes from leaching into the water. The Flint River, however, had high chloride levels and was inadequately treated to lower its corrosiveness in order to prevent leaching of the lead. This leaching resulted in contaminated water from the taps of Flint homes. There were many complaints at the time about the taste, color, and smell of the water after the switch. There were also complaints about various medical issues, such as many citizens developing rashes due to their exposure to the water. The complaints being made about the water were not initially acted upon. It was not until Dr. Mona Hanna-Attisha from Hurley Hospital found that there was an increase in the number of cases of lead poisoning in Flint children. Lead poisoning is defined as a blood lead level of 5 micrograms per deciliter or higher. Dr. Hanna-Attisha found that the rate of the children with elevated blood lead levels rose from 2.5% before the switch to 6.3% after the switch. There were other public health issues associated with the switch to the Flint River water. There was an outbreak of Legionella disease from June of 2014 to November of 2015. There were 87 cases of Legionella during this period, compared to a baseline 13 cases that would be considered normal during the same period. In 2015, Liu et al. Studied whether there was an increased risk of congenital heart defects in babies born to mothers with increased blood lead levels. Maternal hair lead levels were measured using inductively coupled plasma mass spectrometry, and logistical regression analysis was used to calculate the odds ratio. There were 316 cases in the experimental group and 348 cases in the control group. The median level of lead in the maternal hair was significantly higher in the experimental group compared to the control group, and they concluded that maternal lead exposure is associated with risk of congenital heart defects in offspring. In 2013, Mark Edwards performed a study to see if there was an increased risk of fetal death rate or reduced birth rate associated with increase in the water lead levels in the Washington, D.C. area during the lead crisis of 2001 to 2014. The study found that the increased births in the D.C. neighborhoods was correlated to the incidence of lead pipe. D.C. birth rates from 1999 to 2007 were correlated with maternal blood lead levels and the incidence of lead poisoning in children under the age of 1.3. After public health protections were removed in 2006, the Washington, D.C. fetal death rate spiked in 2007 to 2009 compared to 2004 to 2016 in a manner consistent with the high water lead level health risks to consumers arising from the partial lead service line replacement. And the Washington, D.C. fetal death rate dropped to historic lows between 2010 and 2011. The study showed the association of lead exposure to higher incidence of miscarriage and fetal death rates, even at blood levels that were once considered relatively low. There are lead service lines spread throughout much of Flint. Before work was started to replace these lines, there were 4,376 lead service lines. There is a lot of media exposure of the Flint lead water crisis, but Flint is not the only city in America with these issues. Many other cities have aging homes with lead service lines, areas of high industrial contamination, and aging infrastructure. Another city that has lead contaminated water was Washington, D.C. between 2000 and 2004. The D.C. water was found to be 83 times higher than levels that were considered safe. Washington, D.C. experienced higher rates of fetal death and reduced birth rates that were associated with elevated lead in pregnant women, as we learned about previously in the Edwards study. Detroit, too, has its issues with lead. In this study conducted by John Bullitt of Wayne State University, you can see the areas in green are homes with an elevated blood level of 10 to 19 micrograms per deciliter. And the pink dots show elevated blood levels of 20 or greater micrograms per deciliter, both of which are considered unsafe. Lead poisoning is not just a Flint issue. As you can see by this map of the state of Michigan, it shows the number of children with blood level levels of 5 micrograms per deciliter or higher for 2012. You can see that it is definitely a statewide issue with high concentrations in Detroit, Flint, and Saginaw on this side of the state. So how does lead enter the body? Lead enters the body by eating or breathing dust that is contaminated with lead, drinking water contaminated with lead, or ingesting paint with lead from homes before 1978. Children absorb a greater amount of lead than adults. When children ingest lead, up to 50% of the lead can be absorbed into the body compared to just 3 to 10% for adults. So how can you keep your home and children safe from lead? Well, here are some tips. You should get your water tested. You should use filtered water for cooking and drinking. You should only use cold water for cooking. You should wash all your fruits and vegetables with cold, filtered water. When you must use unfiltered water, you should run your water for 5 minutes before you use it. When you have to do this, it's probably wise to fill up some containers so you don't have to run the water for 5 minutes, and it'll save time in the future. You should also drain and flush your hot water heater tank because this is a source of contamination. Dust and dirt may contain lead, and it can settle throughout the home. Regular cleaning of the home can reduce lead exposures as well. Here are some cleaning guidelines. Wash dishes, bottles, and toys with soapy water and let dry. It is safe to use unfiltered water to mop floors and wipe the counters. It is safe to wash clothes. You should use doormats. Vacuuming should be avoided because vacuuming carpets may pull lead to the surface. Use a non-motorized sweeper instead. Clean window seals and play areas often with paper towels and soapy water. If you are a pregnant woman, it is important to reduce your lead exposure because lead can have an adverse effect on the health and viability of your unborn child. Lead exposure in pregnant women can increase risk of miscarriage, increase risk of prematurity, increase risk of low birth rates. It can damage the baby's brain, kidneys, and nervous system, and increase the risk of learning and behavioral problems. In women with elevated blood levels, conditions such as infertility, increased odds of miscarriage, preeclampsia, pregnancy hypertension, and premature delivery are seen in higher numbers. Lead poisoning has adverse health effects for both adults and children, and it affects multiple systems. In adults, lead affects the brain by causing memory loss, lack of concentration, headaches, irritability, and depression. The adult digestive system is affected and can cause constipation, nausea, and poor appetite. Lead affects the adult nervous system by causing nerve damage, which can cause numbness and pain in the extremities. In adults, lead also causes fatigue, joint pain, and muscle pain. It can cause high blood pressure and abnormal kidney function and damage. Men can have decreased sex drive, low sperm count, and sperm abnormalities. Women can also have spontaneous abortions or miscarriages. In children, lead can cause poor growth of both bones and muscles, cognitive issues, lower IQ, behavioral problems, hearing loss, and learning disabilities. Children also have damage to the nervous system, the kidneys, and can develop anemia.